If you take your blood pressure medication every morning with your coffee, I need you to stop and watch this. And if you've ever missed a dose and just doubled up the next time to make up for it, please stay right here. Because what I'm about to share with you is something your pharmacist should have explained the very day you filled that prescription, but probably didn't. In the next few minutes, I'm going to walk you through the 5 most dangerous blood pressure medication timing mistakes I see every single week. Mistakes that can cut your medication's effectiveness in half, or worse, leave your heart completely unprotected during the most dangerous hours of the day. Stay with me, because timing mistake number 3 is the one that surprises people the most. Over the years, I've had countless patients sit across from me and say something like this: "Dr. Patel, I take my medication every single day. I never miss it. So why are my numbers still all over the place?" And when I start asking a few simple questions, what time do you take it? What do you take it with? What do you do when you miss a dose? The answer becomes clear very quickly. It was never about whether they were taking their medication. It was about when and how. Blood pressure medication is one of the most prescribed drug classes in the entire United States. And most patients are told what to take, but not when, not with what, and not what to avoid. That gap in information is quietly costing people their health. And today, we're going to close that gap together. Let me ask you something. Do any of these sound familiar? You take your blood pressure pill first thing in the morning, right alongside your coffee. Or maybe you take your water pill whenever you happen to remember, sometimes in the afternoon, sometimes at night. Or maybe there was that one time you missed a day and figured, "I'll just take 2 tomorrow to catch up." If any of that sounds like you, I want you to know something important. You are not careless. You are not doing anything wrong on purpose. You simply were never given the information you needed. And that ends today. Let's start with something that genuinely changed the way I counsel my patients. Most people on blood pressure medications, drugs like lisinopril, losartan, ramipril, valsartan, were told one simple thing when they got their prescription: take it once daily in the morning. For decades, that was the standard instruction, not because research proved it was best, mostly because it was convenient. It was habit. But here's what the research has since revealed. Your blood pressure is not the same all day long. It follows a natural rhythm. It dips while you sleep. And then in those early morning hours, right around the time you're waking up, it surges sharply upward. We call this the morning surge. And that morning surge, that is when heart attacks and strokes are most likely to occur. Now think about what happens when you take your medication in the morning. By the time that dangerous early morning surge arrives the next day, your medication may have already peaked and started declining. The protection you need most, right at that vulnerable window, may be wearing thin. Studies have shown that patients who took certain blood pressure medications at bedtime had meaningfully better outcomes, lower rates of heart attack, lower rates of stroke compared to those who took the exact same medication in the morning. Now I want to be honest with you, because that's what you deserve. The science here is still evolving. Some studies show clear benefit to bedtime dosing. Others show less dramatic differences. The right answer genuinely depends on your specific medication and your individual blood pressure pattern. But here is the one question I want you to bring to your next appointment. Doctor, should I be taking my medication at bedtime instead of the morning? That single question is worth asking, and the answer could matter more than you realize. This next one surprises almost everyone, every single time. I want you to think about whether you eat grapefruit or drink grapefruit juice, maybe with breakfast, maybe in the evening as a healthy snack. If you take a calcium channel blocker, medications like amlodipine, felidipine, or nifedipine, grapefruit may be actively working against your medication in a way that creates real danger. Here's what happens. Grapefruit contains natural compounds that block an enzyme in your digestive system. one that's responsible for breaking down certain blood pressure medications properly. When that enzyme gets blocked, your medication doesn't process the way it should. Blood levels of the drug rise, sometimes dramatically. The result can be a sudden sharp drop in blood pressure, dizziness, fainting, in some cases, dangerous changes in heart rhythm. And here is the part that truly concerns me. The effect of grapefruit can linger in your system for up to 72 hours after you eat it. A glass of grapefruit juice on Tuesday evening can still be affecting how your medication works on Thursday morning. So please, if you take any calcium channel blocker, ask your pharmacist directly. Is grapefruit a concern with my specific medication? Don't assume the answer is no. Ask. It takes 30 seconds, and it could protect you from something serious. This is timing mistake number 3. And this one carries consequences that most people would never connect to a simple pill. Diuretics, water pills, are among the most commonly prescribed blood pressure medications for people over 60. Medications like hydrochlorothiazide and furosemide, they work by helping your kidneys remove excess fluid, which reduces blood volume and lowers pressure. Here's the problem. Many people take their water pill in the afternoon or in the evening. Sometimes because they forgot their morning dose. Sometimes because nobody ever told them timing mattered. And what happens? They're up 2, 3, 4 times throughout the night using the bathroom. Most people just accept this as normal. It is not normal. It is a preventable consequence of the wrong timing. But here's what I really need you to understand, and this is the part that concerns me deeply as a physician. Every time an older adult gets out of bed in the middle of the night, in the dark, possibly disoriented, with blood pressure that shifts when they stand up, the risk of a fall increases significantly. Falls in adults over 70 are not just inconvenient, they can be life-altering. This is the real consequence of taking a water pill at 6 p.m. instead of 8 a.m. My simple rule for every patient on a diuretic: take it in the morning, before 10 a.m. if possible. If you're on a twice-daily dose, the second one should be taken no later than 2 p.m. That one timing shift protects your sleep, your balance, and your safety. Now let's talk about something millions of Americans do every single morning, without any idea it could be a concern. Taking a beta blocker, medications like metoprolol, atenolol, or carvedilol, at the exact same time as a cup of coffee. Here's what's happening inside your body when you do this. Caffeine stimulates your nervous system. It raises your heart rate. It temporarily pushes blood pressure upward. Beta blockers work by doing the exact opposite, slowing the heart, calming that nervous system response. When both happen simultaneously, you're essentially pressing the gas pedal and the brake at the same time. For most people, the medication wins that battle. But for patients with certain heart rhythm issues, that combination during the peak caffeine window, roughly 30 to 60 minutes after your morning cup, can sometimes trigger palpitations or irregular heartbeats. My recommendation is simple. Wait at least 30 to 45 minutes between taking your beta blocker and your first cup of coffee. A small shift in routine that may carry meaningful benefit, especially if you have any history of heart rhythm concerns. This is the timing mistake I see most frequently, and the one with the widest range of consequences, depending entirely on which medication you're taking. You miss your morning dose. You remember at dinner time. And the instinct, completely understandable, is to just take 2 to make up for it. Please don't do that without checking first. For some medications, doubling a dose carries relatively low risk. For others, certain calcium channel blockers, ARBs, beta blockers, it can cause a sudden, significant drop in blood pressure. In older adults, that means dizziness, possible fainting, and a very real fall risk. Here's the simple guidance I give every patient. If you miss a dose and it's still the same day, take it as soon as you remember. unless your next scheduled dose is coming up soon. In that case, simply skip the missed dose and continue your normal schedule. Never double up without asking your doctor or pharmacist first, because the right answer depends entirely on your specific medication. I want to be completely clear about something before we finish. Blood pressure medication saves lives. The evidence behind treating hypertension is among the strongest in all of cardiovascular medicine. I am not here to frighten you away from your medication. I am here because the conversation about timing, when you take it, what you take it with, what to do when you miss a dose, is a conversation that almost never happens in a 15-minute appointment. And that gap in information has real consequences for real people. People I care about. People like you. So here are 5 questions I want you to bring to your very next appointment. 1. Should I be taking my medication in the morning or at bedtime? 2. Are there any foods, drinks, or supplements I should avoid around my dose? 3. What should I do if I miss a dose? 4. What time of day is my blood pressure typically highest? 5. Are there any timing interactions with my other medications? Those 5 questions, asked clearly and directly, will do more for your cardiovascular protection than almost anything else you can do this week. Write them down, take them with you. You deserve those answers. If this gave you something useful today, something that didn't come up in your last appointment, please share this video with someone you love who is managing their blood pressure. Because sometimes the most caring thing we can do for the people in our lives is simply get the right information into their hands at the right time. And if you want to keep receiving honest, straightforward health information that I genuinely believe every patient deserves, subscribe to this channel. Every week we have a new conversation, the kind that should be happening in exam rooms everywhere. I'll see you in the next video. Take good care of yourselves.